First, I'd like to welcome everybody. This is BI Lessons Learned in Health Insurance. I don't have the microphone on right now because my wife always tells me I talk too loud. So I want to test the guys in the back of the room. Can you hear me okay?
Yes.
I'm going to go without a microphone then today. And the first thing that I want to sort of caution you on, this might be a pro or con depending on what industry you're in, is the lessons learned. You may be a little disappointed if you think, oh, this is going to be very specific to health insurance, health care, because the reality is they're not a lot different. There are nuances along the way, but data warehousing, business intelligence is just that, and it crosses industries pretty well. There are some particular things, though, you do have to address in healthcare, and hopefully I'll get into that with you. A little bit about me. I've been at this about 20 years. I worked in consulting for Ernst & Young, worked for Big Pharma, Pharmacia and Pfizer, and now I'm working in a much smaller organization, HealthPlus of Michigan, north of here about 40 minutes if you don't count today. If you count today, well, a minute, hour 40. I've worked with a variety of back ends, everything from DB2, Oracle, Microsoft SQL Server. I'm not a technical guy, so I'm not sure what those are, but I will tell you, it isn't so much the back end. The ETL tools, again, a whole variety, everything from Informatica, SSIS, to some shareware type things in front end. While most of my front-end experience is with MicroStrategy, I've also done some with Informatica, or not Informatica, but Cognos and Business Objects and a couple others. And the reality is, the tools are the tools. And the key from a BI program perspective is not, there ain't a best one. They'll all tell you they are, right? You've all seen the presentations. But the reality is, you got to find the one that's best for your organization. And you know, one of the challenges that I would pose to you at this point is really be honest with yourself. What is your organization? What is the culture as it relates to data and information? What are they really hoping to accomplish with a BI program? Because that'll lead you in very different directions. And in my presentation, I'll get into that a little bit more. Why am I here? Why am I working for HealthPlus? I truly believe that we have a healthcare crisis in the U.S. And I truly believe that information is going to drive a big part of bending that medical spend curve. To give you a couple examples in healthcare, I can tell you, for our members, I can tell you which ones are most likely to have a heart attack next year. I can tell you which ones are most likely to wind up in the hospital next year. I can tell you on a scale using 1 as the average, which ones are sicker and less sick. And if we really leverage that, and that's the tip of the iceberg. We haven't even gotten into good EMR feeds coming into our systems yet that is going to explode the available information we have on members, on consumers of healthcare. But what everybody in healthcare agrees on, a lot of differences in opinions on how to solve the problem, but what everybody agrees on is if you treat chronic conditions early and keep them under control, that is the key to reducing our healthcare spend. To give you a perspective, for HealthPlus, about 1/3 of our medical spend is people in the hospital. We believe that's about 1/3 too high because many of those could have been avoided. And I'll tell you, when I got into the insurance business, I have to tell this story before I go too much further. I truly believe, like probably many of you did, or maybe do, that health insurance is the evil empire. They're there to take our money, they're there to raise rates, and they're there to not deny us care. And I've been very impressed with HealthPlus in that they are not about that at all. And actually, I would argue the industry is not about that. They are about the right care to the right individual in the right setting at the right time. And you know, if we can move that direction, you know, you're not going to get to the answer, but you're going to move the bar towards that end. Goals of this presentation: provide you some lessons learned. Hopefully, some lessons that have been pretty painful to me. I will be honest, some of them continue to be painful because I'm not so good at it. But if you can do things to modify how you operate in your BI and DW environment, it can dramatically change the success of the program. I want to give you some health insurance specific slant. Again, many people feel, including myself, that this is an absolutely exploding area of opportunity to use data and information to help companies, people, providers be more effective in the day-to-day operations, as well as reducing some of the economic challenges we have. And to go a step below, right? Because everybody else goes a step above, I want to go a step below. And what I mean by that is I hopefully will give you some very specific enough examples that you can take back to your daily environment and say, you know what, I remember that. If I do that, I can make my life a little easier. I can make the program a little more successful. So the top 5 lessons learned. Number 5 is know your source systems. This was a little bit shocking to me as I went from consulting in the automotive environment to pharmaceuticals to health insurance. And each step along the way, I found that the systems were a little less governed, a little less tested, and a little less reliable. So why do I care about that? That's somebody else's problem, right? They're running the transactional systems, why should I care? Well, the reason you gotta care from a BI and DW perspective is all that information, all that data is coming your way. If they don't have good controls in place, you're gonna experience the downfall of that when you do in your reporting, in your dashboards, however you're distributing your information. So that's a key thing in knowing your source systems. Some more you need to know is their existing state. So, you know, how stable are they? How long have they been there? Their problems. How many people have dealt with a source system that it didn't handle a specific business function like it was supposed to? So they had to do some surround code that goes out somewhere else, brings something in, the data isn't validated, and what winds up in your source system isn't quite right. I'll put a little plug for the SAP folks. My first foray into data warehousing was on top of a SAP R3 environment. Highly validated. So very good master data. A customer's a customer throughout the whole thing. In healthcare, one of the first things we did, we're sort of architecting our claims system, and we got our members and everything going on. And one of the first reports we did was claims without members. Now, does anybody here see a problem if you're a health insurance company and you got claims without members? That means they probably weren't paying a premium. You probably didn't get paid, but you paid the medical claim on the back end. That happened. The good news for us is we used it as an opportunity to sell the value of our program to the tune of about $1 million. So we could show that because the legacy system didn't have that cross-validation, we needed to do it in the data warehouse. We got a dashboard and a supporting report today that goes out. So we're actually doing that matching and keeping that under control on an ongoing basis. So opportunity to sell the program, but at the same time, understanding your source system. I've talked about data quality. There are plans to upgrade. Not only the plans, but their ability to execute. So in healthcare, we had to go through, we purposely did not bring in all the provider information, medical provider information, because they had said, even though that was deemed a very high value component of a data warehouse, we didn't bring in many of the attributes because they were going to upgrade in a year. So a good lesson learned that we learned is not only know that they're going to upgrade and that it's going to happen in a year, but also understand that they may not meet their timelines. And if they don't, what does that mean to you and your plans? And then their evolution over time. Something to always keep in mind in data warehousing and BI, the person you're talking to is only as good as how long they've been there, how long they understand the evolution of what's going on. So again, a source system that is solid, been there a given time, the person knows it, or persons, you got a better foundation than you do if you don't. And we're going to get into what you do about that in just a little bit here. Next, get a roadmap and follow it. So I was fortunate enough my first couple of times into data warehousing, that's what we did. It was great, it was all good. When I joined HealthPlus, my sponsor said, why should I waste the time? Why should I waste the money? I know what we need, let's get going. I said, I don't think that's a good idea, but if you know, I'm new here, I'll follow your lead. Huge mistake on my part. The roadmap is what you will use to set expectations, both high and low level. So when I describe a roadmap, because most people will come in and say you need it, right? And most business people that are spending the money to support your program, don't get why. The example I always use is, you've been tasked to build a campus, a college, a university. We've all been there, right? So, you got nothing but green land right now. You need to start building, but that's going to be some roads, that's going to be some initial buildings, but you need to know where to put that first building. Now, when you get to that first building, you're going to need some blueprints, right? To be very specific of what that looks like. Data warehousing is no different. You can start down that path, but you better know where what the long-term vision looks like. Or you're going to have buildings scattered all over the place that don't work well together, that don't make a good campus. Same thing when you get down to that lower level, don't forget that, well, I got my roadmap, I'm good, right? No, you're not. You still need that blueprint, you still need the technical details of how that is going to be architected, because you will find out more when you get into the lower levels, and then how that's going to fit in with everything else. And the right facilitator. So in healthcare, and I would actually argue this in any industry, the facilitator of this roadmap should have almost as good an understanding of your business as you do. And ideally, they should have it not only at your business, but at a few others that were very similar to you. And the reason for that is, if you've got somebody that's naive, or just thinks that it's data warehousing, they're not going to ask industry-specific questions. At HealthPlus, we were fortunate to have an excellent individual, and the roadmap consulting sessions were very dynamic. He challenged all the business users. We had a better part of 40 people in a room, and he could speak intelligently to almost every aspect of our business and ask follow-up questions and follow-up questions. And it helped us get a much better understanding of those requirements and how the model and how the overall data warehouse was going to look when we got done. You probably noticed that the VP came in, we didn't need to do that. We struggled for a little while, we wound up doing it. So again, that's a lesson learned in and of itself. Number 3, data is the key. I'm going to put 3 and 5 together. You know, if you listen closely on know your source systems, really the only reason I want you to know your source systems is I want you to know your data. But at the end of the day, people are going to use your system to get information out. And if you don't have good quality data consistently over a long period of time, you're gonna lose their confidence. The mantra that I use at HealthPlus is, we not only gotta be right every time, we better be able to show how somebody else isn't right. And we do that very well. We spend a lot of time on it. Validate, validate, validate. Again, this is a health insurance nuance. In automotive, pretty good degree of testing. In pharmaceuticals, pretty good degree of testing. It actually stemmed from the necessity to test production systems and that on the FDA side and on producing drugs. And then in health insurance, the testing culture was not there at HealthPlus. So we needed to validate again and again and again. Now, I break that into two pieces. The initial, this is where we're going to get our data, and this is how we're going to use it. And then the ongoing, that, oh, wait a minute, you guys decided to do something goofy in your legacy system that is changing everything when I start integrating the data in the data warehouse and my BI reports. Understand the definitions. We always talk about the source of truth. What is truth? It's in the eyes of the beholder, right? If you're in sales and you think truth is this number of members, and you're in finance and you think it's that, you're both right, because you're looking at it your way. And most times it comes back to definitions. I will tell you, in health insurance, we had an enormous amount of definitions. We had lines of business. Now we only had 8 lines of business. We had 13 different definitions for 8 lines of business. We had 7 different definitions for how do you count how many members do you have. So what that really gets to, and we'll touch on data governance a little bit later, but what that really gets to is confidence of people using the system. We had an enormous amount of distrust in thinking, oh, you're wrong. Well, most times it wasn't that one person or the other was wrong, it was just we didn't have that common definition. And what we did is we utilized the data warehouse program to drive data governance to say, God, we did this testing, we found out all these, which one do we want to go with? And actually what I did for our CEO, because it was, we need them all, right? Everybody's is right, and we got to have them all. Well, what I did for our CEO is I produced a graph over time of our membership. And on this graph, there were 7 different legends, right? Now, he looked at the line and goes, oh, there's something wrong with your graph because there's only one line. It's like, no. It's so close together that you can't tell the difference. So now, do we want to revisit this again? Do we need 7 different definitions, or can we get to 1 or 2? And we got to 1. So again, I use data as my friend there, but you need to know, as the data warehouse, again, if you know your source systems and you know your data as good as they do, that's going to lay the foundation for all the reporting, all the fancy report distribution and everything else you're going to do in a BI platform. Build the system to identify data issues. So one of my developers, I have exclusively dedicated to, they do nothing but build systems for me. And the systems they build for me are looking at source systems all throughout the organization and identify any time that there might be a data issue. Now, we're pretty confident, we've done a lot of testing, that our systems are going to bring through the data that's in the source systems. What we're not confident of is what might change that we're not aware of. So by doing this, sort of the rule I use is if a business user were to look at a report and say, wait a minute, membership is down 10% or 5% or whatever that number is, they would say, wait a minute, wave their hands and say something's wrong. We build back-end data quality checks with those same thresholds so that we look into it before they even ask, and we send out proactive communications to say, you know what, membership increased this amount in this area as a result of. And what that's really doing in our eyes is that's building the confidence that, you know what, when I look at something that comes out of this DW program, this BI program, it's right, because they've checked it. They catch it before I do. Bring it all in. Big lesson, I've learned it 3 times, I'll probably learn it a couple more times before I'm done. And that is, what data elements do you need for your analysis, for your reporting, for your whatever? And you'll talk to business users, they'll have it, and every time, it's like, well, we should have brought this, can we bring that in? Well, it's a lot harder to bring it in after the fact than it is to bring it in right when you do it the first time. And my latest approach is, when we go to a new source system, we look at all the fields and we say, tell me why I shouldn't bring that in. What is the downside of having it? I can make it so nobody can see it. I can do, we might never report on it. My infrastructure person might not like me because I'm using up more disk space, but you tell me why I shouldn't bring that in. And really what that whole approach is driving is when we change our mind, when we find out why that's an important piece of information, and hopefully it is, we're storing it in some system, right? When we find out why and how we're going to report on it, we've got it, and that makes that iterative development cycle much shorter. I've already talked about source of truth a little bit, and that's really, it depends on the user, but really, the more you can shrink those, the better. Investigate your partners. How many consultants do I have in here? I want to make sure I know where the objects are coming from. This is extraordinarily important because a good partner, you can forget everything I told you today because they're going to have this covered for you. A less than quality partner, you're going to get some. Almost all consultants have an inch and have a strength. So I'm a big proponent of using them. But you got to know what you're getting and how they fit in your program and where they're going to solve your problems. Don't fall for the dog and pony show. My first partner at HealthPlus, my sponsor was at a conference, saw the presentation. This guy is the answer to our problems. We don't need to interview, I got it covered. And they weren't. The whole thing here is, they're pretty good at dog and pony shows, but again, take that as a starting point, not as an ending point of, I need to do business with this person because they gave me a lot of good reasons to do that. Tools is good, industry better, data is crucial. That's your consultant's knowledge of. So a lot of times you've chosen your tools before you get your consultant. They're an expert in MicroStrategy. Let's go down that path. That's a good thing, but do we care about MicroStrategy at the end of the day? If you saw Mike's presentation in the morning, it's all about adoption. It's all about who's using it, how are they using it, are they making their business more successful because they're using your product here. And if you're focused on the tools, you're probably going to miss that. Industry is better, so you want that industry, but again, that data experience. So when that consultant comes in and says, this and this and this about your data, and they say, well, but what about this and this and this? And you have your users, your technical people, your whatever say, oh yeah, I forgot to tell you, or oh, that's over here, or that's when you know they got a very good understanding of how all the pieces of your business fit together. Know the staffing on your project. I am a big believer, I mentioned earlier, lots of tools, lots of different things that I've seen throughout my career. The right people on your project, the right DBA, the right ETL developer, the right data modeler, they're going to make a huge difference in doing it the right way. When I first got into pharmaceuticals, we had 30 plus people on our data warehouse project. We were just getting started at Pharmacia. And come in every day and I'm learning about it, and man, that seems like a big team. Oh, we gotta have them. At the end of the day, we had a team of about 7 people, and they were getting done what the 30 people were, because the good people know how to get it done. They understand the data, they understand the systems, they've taken the time to learn that. The average people are just gonna know the tool and know how to shove something through there, but might not get the end result you're really looking for. Make sure you get the right people on your project. Don't let your consultant companies play bait and switch on you. Size and scope. You know, if you're a huge BI program, if you're a smaller one, you got to know how you fit and you know how that consultant fits with you. I would look at what size and scope of projects have they been on. You know, a lot of times you'll have the consultant come in and say, gee, we've done this huge project for General Motors, That's great, but I'm a small little shop. I gotta have people that understand a broader range of things and not a different consultant for every aspect of the project. Yes?
Yeah, a couple questions. One is, you're with HealthPlus, correct?
Correct.
I did come in a little late, so I was curious to know, can you show us what you did with this methodology? It's like a case study or something that you could give us some credence?
I wish I could. This is really a lesson of hard knocks, because I will tell you what we did is we hired a consultant that knew MicroStrategy, because we had chosen that tool. And they came in and quote unquote, we got nothing to lose because it was fixed price. We did have a lot to lose because we wasted our time, 8 months of it. We wasted our money because we paid them 60% of the cost of the contract, and that's at the point that they came to us and said, this is a lot harder than we thought, it's going to be double. And we said, no, right here, it's fixed price. And they said, well, then we're not going to do it. So I wish I could give you a case study. That it's really a case study in reality that, you know, there are no guarantees, and I would go back to the industry is better, the data is crucial, because what we wound up doing is we wound up taking internal developers. Remember that good roadmap consultant I told you about? We modeled, when the MicroStrategy consultant went south on us, we said, we're going to follow his model to the T, and we are going to have to go to our executive board before we change. We made it that hard. And we did change a few things because they made sense. He even agreed as we learned more that that was the right thing to do. But we followed the model, we followed the roadmap, and we had much better, that's when our program really took off. And you get what you pay for. And this is a difference. I was in pharmaceuticals, I'll call it in the heyday, when Viagra and Lipitor and all the drugs weren't generic yet, and everybody was making lots of money. I won't say they didn't care about money, but it was a lot easier to get. Health insurance, a lot tighter margins, a lot more uncertainty right now, so they're a lot more careful. But you do get what you pay for. There are a lot of consultants out there that'll do it cheaper, do it fixed price, do it whatever. Don't make the price the last thing you compare on. Compare on their industry strength, their tool strength, their data strength before you get to looking at price. And finally, know your sponsor. The reason I put know your sponsor, my wife, I got to tell you, I sort of tried to do this presentation in front of my wife to practice a little bit. She goes, know your sponsor? How can you not know the person you're working for? And I said, well, you know them, just like you know your neighbor, but you don't know everything about them. And when I say know your sponsor, what I'm really talking about is understanding how much of a sponsor you have. And I'm going to go into that in just a little bit here. So good sponsor characteristics, extremely well connected in the organization. So typically your sponsor is going to be a part of the organization, not the whole thing. You know, CEO sponsor is very uncommon. So his ability to go to other high-level executives and get them to buy in, get them to use your product, get them to support you with their group's time is absolutely critical. Can he write the check? So I've gone through a few sponsors, and what I mean by that is I've had sponsors that I literally spend half my time doing PowerPoints so we could run to somebody and try and secure funding. And I've had other sponsors that you sit down and you say, here was the roadmap, here's where we are, this is what we're doing, we're right on time. 10 minutes? Okay. And that sponsor made things happen. It made the program move a lot quicker and was a lot more effective. Sponsor types to look out for. I'm just going to throw a couple at you. The ladder climber, we've all seen them in the organization. I'll lead the BI program. It's sexy. It's out there. Everybody is recognizing it. They'll be there a year and they'll be gone. BI programs are long-term effort, guys. You want them to be in it for the long haul, and you want them to be in it for the vision. The vision that information is going to take the organization to the next level. So what can you do if you're assuming you're not a sponsor, what can you do? Well, I'm going to talk about that in some of the other lessons learned. Choose your tool objectively. What I mean with that is be honest about what your organization is about. If your organization truly views information as a competitive asset, as a competitive differentiator, you'll be able to get a little more funding. You'll be able to get a little more patience with the time it takes to do it right. If your organization isn't that, if your organization says manufacturing's the key, selling's the key, you can fill in the blank. You better be ready to not quite have as much support. Again, that's going to be largely dependent on your sponsor, right? You got a good sponsor that's in it for the long haul, that's connected, that can write the check, you'll be in better shape there. Proceed incrementally. Once you get out a little information on your program, you're going to have everybody wanting a piece of it, especially if it's a sexy dashboard on an iPad that they saw in a meeting. Well, everybody's got to have it. Proceed incrementally and say, go back to that roadmap. This was the plan, guys. This is where you fit in. And have some flexibility, but make no mistake, stick with the roadmap. Data governance, we talked about that. The one lesson learned I have there is I've got into it twice. Steering committee, user groups, all different levels, all different meetings scheduled for a year. Until you got the 7 different definitions of member, you don't have a reason to meet. And people start meeting, they talk about all theory of data governance, and you don't get anything done. So start small, start with a reason. You need to advertise. Mike mentioned this, I'll mention it. The best form of advertising is word of mouth, right? Get a tool, get an answer to a problem in the hands of somebody in your organization that is going to raise their hand and say, this is great. That's how you get momentum. That's how you sustain long-term success in data warehousing. We've talked a lot about fit. What's in it for me? Analysts, executives, managers, line workers, even team members. Know what's in it for them, what's getting them excited. Because, again, I'm going to leverage Mike's presentation a little bit. This is a business. If you understand your customers, all of them, you're gonna do better. And when I say executives versus analysts, you know what? That's sort of like if I sell flooring and I land the GM account, get the Renaissance Center. That's a pretty big job, right? That's sort of the equivalent of a executive. If I if I do it one at a time, like at an analyst, and I get that support, it all matters, but there's different levels of support. I will tell you the best thing that we did, I mentioned that iPad with some drill down capabilities, with multiple graphs. I had one executive that was bought in. I put that in their hands. They went to an executive meeting and they started answering questions. It wasn't no more, go back, I gotta call somebody, we'll analyze it. He's right there in the meeting answering questions. That's when we got a lot of traction. Hardware's cheap. So this is my IBM advertisement. Guys, hardware is cheap. It's relative, but it's cheap. If you are coding, if you are trying to get around limitations of your hardware, you're burning time, and time is very expensive in data warehousing. And then the last thing is balance everything. If you got a BI, DW program, you got to balance all these things, and depending on your situation, know which one is going to hurt you the most or help you the most. And again, if you're running it like a business, knowing your customer, knowing where your costs or limitations are, you'll do just fine in choosing the right ones. That's all I got. Questions?
A quick question. You mentioned about the partner and the experience you had. So would you say more than the technology expertise, you would prefer to have a lot better business expertise or the industry expertise?
I'm going to go business degree, technology. A good partner is going to have that balance. But really what I believe is the most important is that deep industry experience, your data and your processes and your industry challenges is where I would put that focus. And the reason for that is, and this is probably more true in healthcare than maybe a couple of other industries that I've been a part of, is because it is very unique and it has a lot of regulated, a lot of things it can't do for certain reasons, and you got to do that. Now, the technical degree, you know, I'm a big believer that it's people, right? So if you bring on that partner and they don't have the deep technical capabilities in the key areas, ETL, DBA, and BI development, you're still not going to get there. So you got to have the balance. Any other questions? Thanks for coming.